stay-at-home order, state and local leaders have routinely cited the lack of testing as the biggest challenge.
Secretary of Public Health Dr. Mandy Cohen recently said testing needs to be improved before she would make a recommendation to reopen. CBS 17's Holden Korwicki spoke with a team of experts at Duke today. He's getting answers about what the ongoing issues that are plaguing the state. Holden.
Well, Angela, there are about 2,500 people per day that are tested here in North Carolina. And if you do the math on that, that makes about 11 years before every single person in North Carolina could be tested at current rates. Now, the experts that I spoke with at Duke say the issue isn't the quantity of the test, but rather the quality.
We're in a war and we're racing to get all the tools ready.
In the fight against coronavirus, there may be no greater tool than testing.
There's no question that more testing needs to be performed. I actually think we're probably underutilizing testing capacity that exists.
You know, every company that could conceivably put out a test has put out a test. And there hasn't really been the quality control that this needs.
As it stands, there are two types of tests for COVID-19 that pose the same problem.
We don't know that they're all measuring the same thing.
Tests seeking out the virus have shown early success in stopping the spread.
If we can really damp down our ongoing level of infection to a very low level, it's a lot easier to track the hot spots that pop up and jump on it.
Testing for antibodies has recently become more popular, but even if you've had the virus, that doesn't mean you're immune moving forward.
At this point, we've done such a good job with the social distancing. The expectation is that the rate of immunity will actually be quite low, which means we would expect there to be, over the course of the next several months, periodic outbreaks.
That's why doctors are pushing for a national database that measures baselines for the virus before we ease social distancing restrictions, as testing inevitably moves out of labs and into homes.
If you don't get that baseline down, it becomes a game of whack-a-mole.
Now, as it stands, most facilities aren't retesting patients before releasing them. I'm told that moving forward, as more tests become available and those tests improve, that might become a necessity of that retesting. That way it will help medical professionals get a better understanding of exactly all of the causes of coronavirus. Live in Raleigh, Holden Korwicki, CBS 17 News.